Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about orthotics. Now, I've done some other videos on this, and there's some videos you can go back to and so forth, but I want to just give you 5 quick categories when it comes to shoe inserts or orthotics. And you're going to notice in these 5 categories, the shoe inserts that come in shoes are not included because they're usually nothing. They're usually not, a lot of times not even in pads. If you have a good quality shoe insert that comes in the shoe, it's going to fit probably in the first category. The first category is any of those inserts that are like gel inserts or memory foam type inserts, and they're really just pads. So when you go to get a good Dr. Scholl type insert, a lot of times they're going to be padding, they're going to be taking the pressure off, and they can be valuable for some purposes. You're saying, okay, I just need something that pads my foot. Sometimes that's all you'll need. Reduces pressure, reduces some of the problems here, especially as you get older and you start to lose the fat pad on the bottom of the foot. These pads can be valuable, but all they are pads. They're not real shoe inserts or orthotics. Option number 2, or category number 2, is going to be the inserts that you can get that are designed theoretically for a certain condition. You say, okay, this is for plantar fasciitis, this is for heel pain, this is for arch pain, those kind of things. A lot of times, if you stand on one of those machines and at the grocery store or at the pharmacy, and it just scans your foot and says, this is the insert you want, and you just pull it off the shelf, this is going to be category number 2. They're better than the pads. They're not much better than that, but they are better than the pads. They're basically going to say, okay, this is a little bit designed for the way you walk. If I was going to go get an insert for plantar fasciitis, would I do that type? I would not. Would I go in the store and say, oh, this says it's for plantar fasciitis, that's what I'm going to use? Again, I would not. That's not going to really give you the benefit, give you what you're really looking for. Number 3 is going to be those inserts that are going to be a little bit, cost you a little bit more. They're going to be a little bit more firm. They actually have support. They're going to kind of support your arch a little bit. A lot of times, if you go to a running store, it's going to be in this 3rd category that you're going to actually get those, and you can say, okay, these can be valuable and can be useful in that way. Just by, do I have a low arch or medium arch or high arch? These are going to help to a degree in supporting the arch. These are arch supports. Arch supports are beneficial in supporting the arch, keeping the arch from falling. A lot of times, if you've got a really flat foot or a really hard arch, these are going to be worthless as well. For me, I'm pretty flat-footed. So if I put an arch support in my shoe, usually it makes my shoes more uncomfortable. It usually makes my feet hurt more. The 4th is going to be inserts that are based on how you walk. Some of these specialty stores that are going to say, I've got these inserts that I can give you that will take away your problems, take away your pain, so forth. Or you go to even some doctors will give you a type where it's either heat moldable, or they pull them off the shelf and adjust, put a different lumps on them, different things like that, and they're hard plastic that they can pull off the shelf and give to you immediately. These are that next level. They're either a semi-custom or modifiable type device, and they can be valuable in a lot of situations. If this is the case, what you really want is you want something that's going to modify the way you walk. You don't want an arch support. You don't want something that's going to push on your arch. You want something that's going to actually rotate the whole foot in these semi-custom or modifiable options, not just something that's going to support the arch or it's not going to do any good. If you go to a doctor and they're really saying, look, I'm creating you an arch support, that's a problem. That's really not what you're looking for. The 5th option is the best option. So in the 4th option, of course, there's going to be different levels of effectiveness of these inserts. And so you got to be careful even in that area. But the 5th option is a fully custom orthotic where you go to someone that specializes in gait analysis, where they're going to actually watch you walk. They're going to say, okay, based on how you walk, we're going to create you a device. And they're going to either do a scan of the foot, they're going to put you in a foam box where they actually put your foot in a position and put it in the foam box, or they're going to do a cast mold of the foot. I prefer cast molding the foot because I can actually put the foot exactly how I want it in cast mold and get the best device that way. Some individuals claim they can do it with foam box, and that's great. Some individuals say they can do it with the scan. You got to be careful with the scan because you don't want them just to hold a plate up to you and have a scan. You want them actually to put you in a good position with your foot to really get a good quality custom orthotic. Now, with the custom orthotic, at that point, there needs to be several different steps for it. One, the foot needs to be put in the correct position to get the image of the foot. Number two, they need to have watched you walk. They need to do a gait analysis so they know what you're doing so they can modify what you're doing. Number three, they need to write a prescription. They need to create a plan for how it's going to be treated, not just treat it. And through those three things, then you can actually get an insert or an orthotic that's going to change the way your foot functions, which ultimately will allow you to function at the highest level and allow you to not have pain, allow the foot to function more in the neutral position, so all the muscles, tendons, bones, and joints are all optimized and working in the best position they can be. This is really valuable. This is something you should be thinking about. And as you're doing this, that's what you should be looking for. Okay, if I'm gonna pay the money for an orthotic, I want someone that watched me walk. I want someone that knows what they're going to do as far as getting the correct mold of their foot. And I want someone that's going to be able to write a prescription to make it work. And truthfully, my recommendation is you should be able to come in and they should be confident enough with what they're doing that they can guarantee them. They can say, look, I can modify it and make it work and make it comfortable for you. In our practice, we actually guarantee the orthotic so people can come in and get them and they can get their money back if they do not work the way they're supposed to work, because we can usually make them work. This is Dr. Brandt Gibson. This is your Podiatry Tips Day 372, orthotics, and some of the things you should be looking for when you get inserts or orthotics for your shoes. If you'd like additional information, you say, okay, look, I'd love to be evaluated or come in and be seen. You can go to utahfoot.com. You can ask additional questions. You can make appointments. You can actually come in and be seen. The point is, let's optimize the way you walk so that you don't have any limitations or any problems that could come with that.